Hello friends, good morning. Today I would like to introduce a new topic to you. It's called Transient Global Amnesia or TGA. It is nothing but a sudden abrupt memory loss. So, in a patient who may be either young or old, it means that you suddenly lose your memory, not of yourself or your family, but of your place and surroundings and time. You would lose everything. That means that you can do everything. You can drive. You can do all your activities normally, but won't be able to recollect. Suppose say if they had taken food in the morning, they won't be able to recollect. Suppose if you told him that this is in the office or something like that, he would repeat the same question: Where am I? Where am I? Why am I here? How do I get here? Not that who am I or who are you, like that, because they fully appreciate, fully are aware of themselves, their relative, their surroundings, the past history, everything related to him and his self and or the surroundings are perfectly clear. Only things that he won't be able to recollect or form any new memories. This can last from few hours to 24 hours, usually 8 to 10 hours. Everything else will be normal, his conscious level will be normal, there won't be any weakness or a facial droop or a headache or a loss of consciousness or epilepsy, nothing would be there. Just that loss of memory, they don't know where they are or why they are here or why these people are around me or what happened to me, and they would be emotionally they would outburst in tears or something, because they would be extremely anxious during this time. This is not a stroke, this is not an epilepsy, this is not a migraine attack, this is not something else. The term is called transient global amnesia. This is something different from Alzheimer's dementia, where that it's a relentlessly progressive condition where you would lose your memory, your other cognitive abilities like reading, writing, naming, your praxis, ability to manipulate objects, ability to read, ability to understand, ability to comprehend, your executive function, your gnostic function. That means even if you are closing your eyes, you know that it's a pen. Okay, it's called your gnostic function, your everything will be affected in case of Alzheimer's. Here nothing would be affected except for memory. This is called amnesia. Amnesia means memory loss alone. This wouldn't progress. This won't progress beyond a few hours, maximum 24 hours. Okay. Here his MRI will be normal. Maybe in some case there will be some few dot like hyperintensities in the hippocampus in MRI. EEG, there is electroencephalogram, will be perfectly normal. His blood sugar will be normal. Other blood parameters will be normal. And sometimes if the patient, the person has taken some drugs or toxins or some marijuana or some hallucinogens, they are prone to develop this condition. And this transient global amnesia is also common in people who are overstressed, overworked, or due to emotional trauma, or who did some well-service, like straining at various activities, sexual intercourse, head trauma, maybe some migraine, or angiogram, surgical procedures, some anesthesia. So, in all this, they are prone. Not that this is very common. It has been reported. That's all. Okay. And of course, you should always be careful of such condition like epilepsy. But usually, epilepsy and the memory loss related to epilepsy lasts only a few, maybe half an hour to 1 hour. It won't last for 24 hours. So that you should be extremely careful. So it may be an epileptic amnesia. Secondly, various conditions called Wernicke's encephalopathy with deficiency of vitamin B1, herpes simplex encephalitis, that's a viral encephalitis, or recent head trauma, hypoglycemia, TIA, stroke, migraine. Such things can also masquerade, or these are the differential diagnoses. You should be careful. So that apart from the history, everything will be normal. His physical appearance as well as this neurological examination, cardiovascular examination, heart, lung, kidney, everything will be normal. And every investigation will be normal. EEG and the blood test will be normal. But always, you should have an differentials that you should always roll out these conditions related to the stroke, related to the epilepsy, related to like a PCS stroke or TIA in the vertebrobasilar territory, some epilepsy like frontal lobe epilepsy, complex partial epilepsy, some stroke like syndrome. It should be, because there are certain stroke, they would come with a memory impairment, but that would remain for some time, usually associated with other manifestation as well. It wouldn't stand like it's a sudden, they won't ask where am I, who am I, where are you, how did I get here, something like that. And they would be associated probably like either the MR on the clinical examination or a neurological examination. It's a different cup of tea altogether. Right. So, the investigations are normal, the examination is normal, it's a transient benign phenomenon. This will not lead to a stroke, unlike a transient ischemic attack where there is a chance of getting a brain stroke is much higher. This won't give rise to dementia. This is not a part of the Alzheimer's dementia. Okay. This is not related to migraine, because even migraineurs they don't have a consistent relation to transient global amnesia. Head injury sometimes can masquerade like this. So, you should always get a history whether he had fallen, whether he had taken alcohol, because there is one condition, alcohol blackout. Suddenly you lose your memory, alcohol blackout. Okay. Hypoglycemia, suddenly you should never miss a hypoglycemic attack when the patient comes to you with memory impairment. So, largely the treatment is supportive. You just make sure that the patient is comfortable, the relatives are comfortable. Just assure that it's a benign condition, nothing is wrong, but of course you have to do the baseline investigation like a sugar, electrolytes, EEG and scan, because otherwise you can miss many things. So, you don't have to treat as for a stroke, or you don't have to use any medication. You don't have, for this condition alone, it's a benign condition. You can just leave him alone, just reassure him that it's it's maybe some related to some emotional stress or emotional trauma, and you should lead a happy, stress-free life, do regular exercise, good diet, good food, good sunshine, and interact with your colleagues and friends, and avoid unnecessary stress. Always aim for a eustress, not distress. Okay. So, I hope I could give you a bird's eye view on this topic of transient global amnesia. This is relatively common in the community, especially in the neurological circle, and I am sure that many physicians and doctors are also they must have experienced this particular desire or frightening condition. It's called transient global amnesia. Thank you very much. Bye.